Hello everyone, welcome to Kibabi University, where we impart knowledge for development. My name is Lynne Lusaka from the Health Service Department. I'm here to talk to you about our health services at the university. I'm a clinical officer. First of all, congratulations for having been selected to this university. There are a few procedures and processes I'm going to talk to you about. First of all, I'll talk to you about how to access the health services, the procedures and protocols that you need to go through to access the health services. I will also talk to you about how to handle emergencies, how to deal with the public health issues and COVID-19. So first of all, for one to access the health service at the clinic, you must fill the university form, the medical form. This form entails your particulars, your details, your history of vaccination, and then there is a part where you're supposed to take to a medical doctor or a clinical officer at a health facility near you, where some other information will have to be filled. And the most important details that we'll be looking at is your registration number on that form, and then you must also indicate your parents or guardian. You include their names, and then you also indicate their phone numbers. And if you could even add a neighbor, so that in case of an emergency where your parent cannot be found, you also have to, we may also need to contact your neighbor. Then the other part that's most important for you to fill is the typhoid, information about your typhoid vaccination. When you are tested for typhoid and you are found to be having typhoid, then you'll need to be put on medication. So it has to be indicated. And if you are found to be negative of typhoid, then you need to be given a typhoid vaccine. You'll find there is a place you have indicated in bold that you are supposed to have a typhoid vaccine. That is mandatory. So you need to produce the typhoid vaccine card as the evidence for having been vaccinated against typhoid. And that's what we shall be checking on Monday. From Monday when you report, those who report on Monday, Tuesday, that's what you shall be checking as you report. It is mandatory. You will not proceed to the various steps unless you have given us the typhoid vaccine card as an evidence or evidence of being on treatment for typhoid. We encourage this because in Bungoma County, we are living in a typhoid endemic zone, and then we also have students who stay outside in the hostels, and we find that these hostels are so close to each other. So most of the time, you find that the latrines are so much close to the boreholes, the boreholes where students get their water from. So you find that this water may be contaminated, and that's why we insist that one must get that typhoid vaccine. Then the other thing we shall be looking at is for you, when you're, in case you're above 18 years, I know there are those who are below 18 years, but for those who are 18 years and above, you're encouraged to take your COVID vaccine. It's important because, we are in the COVID pandemic. So kindly go get your COVID vaccine. And then the other thing we are encouraging you to have is a mosquito net, because this is also a malaria endemic zone. For students who are coming from Mount Elgon region, the Rift Valley region, the central Kenya, Coast Province, and the larger eastern and northeastern. Those regions, the kind of malaria in those regions is quite different from the malaria we have this side. And right now we are having long rains, or rather the rainy season. So we are expecting that malaria is here with us to stay. So kindly we are encouraging you to carry a mosquito net so that you are well protected. The other thing I want to talk about the medical form. That medical form is is the one we'll use to open a medical file for you. So that medical form is very important. Kindly bring it along, fill it duly, just like I've already explained to you, and then we shall open a file for you. So anytime you are on campus and you fall sick, you'll not pay any money. There's no cash you'll pay at the clinic. All services at the clinic will be free, totally free. No one should demand any cash from you, and no one should tell you to go outside or rather to an external facility for service when the very service you can get it at the clinic. Then there are services which you shall access at the clinic, and there is a procedure. First of all, when you arrive, you have to begin at the health records office. From the health records office, after picking your file, you'll get to the reception where you'll have to go through triage, where we'll check your vitals, that is the temperature, your weight, your blood pressure, and then the oxygen saturations. Then the nurse will send you to the clinical officer where you'll have to be examined. You'll give your history, you'll get examined. Then the clinical officer will either send you to the lab for various lab tests, and then after that you'll also be sent to the pharmacy, depending on the findings of your lab results. So though sometimes it's not mandatory that all illnesses have to go through the lab. Then at the pharmacy you must present an official prescription. So you can't just walk into the pharmacy and demand for treatment. You must pass through all these processes. And then there are also some special cases which we handle. For example, we may have an emergency. Like you may fall sick in the hostel, whether on the university, the main campus, or maybe you are staying outside in the hostels. If you are staying on campus, you talk to your roommates to support you, or rather you talk to the janitors or the janitresses. They will bring you to the clinic. And if you are staying outside the university campus, that is on the hostels outside the main campus, there are wardens. You must link up with the wardens. Then the wardens will call the clinic for assistance. And sometimes if you find that you are staying in a hostel just nearby, you don't have to wait until you go through the entire process. You just walk in anytime. The clinic works 24/7, Monday to Monday, 24/7. You walk in, you'll get your services. And then the other special cases we handle, like for example, you've had an accident, or sometimes you get an injury. Walk there anytime, you will be assisted. But then there are also some special emergencies, like for example, when you get injury on line of duty. For example, you are out playing in the field for sports events, you are playing for the university. In that event, the university will take care of any emergencies that will need a referral. For instance, in case you need a referral for any medical case, that one will be taken care of by the parent. The university will not take care of that. But in case you are injured while in line of duty, that is in the events of maybe you are doing sports, or students who are in the journalism, maybe you have gone out to do an event, then in that case, the university will take care of your treatment. That is outside the campus. And then students are also encouraged to have the NHIF card for those who are above 18 years. And for those who are below 25 years, but still within the same bracket, if your parent has an NHIF card, it will be better, because your parent's NHIF card will take care of your siblings and other family members. But you see, if you just take one NHIF card for yourself, it will be for you and it will not benefit the other family members. So we encourage parents to have an NHIF card, so that in case of any medical emergencies, the university will assist with an ambulance to ferry you to whichever facility whichever facility the parent will decide. Then the other thing I want to talk about is public health matters, where I've already talked about having the mosquito net to control malaria, but then I also want to talk about food safety, food and water safety. On this campus, we have the main catering unit where we prepare our meals from. All our catering officers are tested and vaccinated, so the food we prepare there is safe. But in case you are eating your food from outside campus, it means you may not be very sure of the water, of the safety of the water and the food. So you must take care of yourself. It is your choice. We don't give restrictions on where the students must eat, but we encourage you to eat on campus because our food is safe to eat. And then the water to drink, have a jerry can where you can keep your safe water for drinking. We encourage you to use the water from the taps because it is safer than taking water from other sources. Although at times we encounter shortages of water, so that's why we encourage you to always store some water for yourself for drinking. Then I also want to talk about this COVID-19 protocol. You are all aware that we are having COVID-19 with us, so the messages remain the same. I've talked about the COVID-19 vaccine, but I want to emphasize on masks. Kindly wear your masks throughout. Get used to wearing your masks. Carry enough masks for the entire semester. Then keep social distance. Avoid crowded places. If you're in a crowded place, ensure you are safe. Then the other thing is hand washing and checking of temperature. When you enter the gate, you must have your mask on, your temperature shall be taken, and then you must wash your hands. At all entry points at the administration block, at the library, at the catering unit, in the health service unit, and all those areas, you'll find that you have designated areas for hand washing, and you also have designated areas where your temperature has to be taken. So kindly adhere to the protocols and then fill that form. There's a form you're supposed to fill so that in case you flout the COVID-19 protocols, there are disciplinary measures that shall be taken against you. So in summary, for you to access these health services, there's a student ID card which you must produce. When you join, the IT department will issue with an ID card, the student ID card. So that ID card, you must produce it at every service point, especially at the health service unit. Without the student ID card, you'll not access any service. In case your ID card gets lost, get in touch with the Dean of Students. They'll assist you to get the ID card within 24 hours. And in case you don't have the ID card, then you must produce your admission letter and the national ID, and the names must tally. Otherwise, you'll not access service. So all in all, as we wait for you to arrive, kindly ensure that you present the duly filled medical form, and you also present the necessary vaccine cards as evidence of vaccination. I wish you an enjoyable stay in Kibabi University. I wish you a good time. Success to all of you. Thank you.